Hello everyone, my name is Yuping Chin. Today I'm going to share a reflection on a clinical encounter that involved my family. I will focus on the health professionals who participated, how they worked together, and whether it might have been beneficial for other professionals to be included. I will also reflect on what I learned from watching them communicate and coordinate. Several months ago, my grandmother was admitted to the hospital with pneumonia. It was a stressful time for my family because she was older and already had several chronic health problems. During her stay, the two main health professionals we interacted with were the physician and the nurse. The physician was responsible for diagnosing her illness, deciding on the treatment plan, and prescribing medications. He explained that she would need antibiotics, fluids, and close monitoring. The nurse carried out much of the daily care. She gave my grandmother her medications on time, checked her vital signs, adjusted her oxygen, and made sure she was comfortable. At first, I thought that two professionals might be enough, but as the days went by, I began to see both the strengths and the limitations of this arrangement. The physician and nurse each had important roles. The physician used his expertise to make medical decisions, while the nurse was the one who saw my grandmother most frequently and noticed small changes. Their teamwork allowed the plan to be carried out smoothly. I remember one morning when my grandmother was having more trouble breathing. The nurse quickly notified the physician, who came to the room and adjusted her medication. That fast communication made a real difference. Still, I also thought about how other health professionals could have been involved. A respiratory therapist, for example, could have given my grandmother breathing exercises and taught her how to use equipment to clear her lungs. This might have improved her recovery and lowered the chance of future problems. A pharmacist could also have been very valuable. At one point, our family worried about how the antibiotics would interact with the medications my grandmother already took for blood pressure and arthritis. The physician reassured us, but a pharmacist could have provided a deeper explanation about drug interactions and side effects. Including these professionals would have made the care team more complete. Another professional who could have contributed was a dietitian. Pneumonia often makes elderly patients weak, and nutrition is an important part of healing. My grandmother ate very little during her stay. A dietitian might have suggested high-protein meals or supplements that were easier to swallow, which could have given her more strength. In addition, a social worker might have been helpful for our family. We were stressed about her hospital stay, and a social worker could have guided us on resources for home care or follow-up visits. These examples showed me that while a small team can be effective, a larger team sometimes gives better holistic care. As for teamwork, I would say the physician and nurse worked together fairly well. The physician gave clear instructions, and the nurse kept him updated on changes. They treated each other with respect and stayed professional. However, there were moments when communication with our family could have been improved. For example, sometimes they used medical terms that we did not understand, and we had to ask more than once for clarification. If they had slowed down and explained things in simpler language, it would have reduced our anxiety. This reminded me that good teamwork is not only about professionals working with each other, but also about including the patient and the family as part of the care process. Watching this encounter taught me that collaboration is not just a word, it has a real impact on outcomes. When professionals work well together, the patient feels safer, the family feels more supported, and the treatment is more effective. When communication is lacking, even small misunderstandings can create stress. I now appreciate how complex healthcare can be and how important it is to recognize the strengths of each profession. In conclusion, my grandmother's hospitalization showed me both the value and the limits of a small healthcare team. The physician and nurse worked hard and supported each other, and their coordination definitely helped my grandmother recover. At the same time, I believe that including other professionals, such as a respiratory therapist, a pharmacist, a dietitian, and even a social worker, could have provided even better care. The major lesson I learned is that effective healthcare is truly a team effort. Each professional brings a unique perspective, and when those perspectives are combined, patients have the best chance to heal. My take-home message is this: Healthcare should not be seen as the responsibility of one individual, but as a shared responsibility across professions. Good teamwork, clear communication, and respect for each role can transform a difficult clinical encounter into a positive and healing experience. Thank you for listening.